Good morning. A warm welcome to my session on living with dementia. I would like to thank the coordinators of ARDSICON 2024 for organizing a conference on new frontiers in dementia, diagnosis and cure. I would like to present a session on living with dementia. Let me introduce myself. I am Dr. Sindhu N, Professor, College of Engineering, Trivandrum. I am also having a position of Joint Secretary in Alzheimer's and Related Disorders Society, Trivandrum chapter. I am also having a Dementia Care Center, Orma Dementia Care Research and Development Center. I am the chairperson of the center. So on behalf of all these designations, I would like to discuss a few things on living with the dementia, a patient's perspective. So let me share my screen. So, living with dementia, a patient's perspective. So, I hope the slide is visible. The contents of the slides are the background of dementia, the statistics, introduction, something related to dementia, early symptoms of dementia, the global dementia statistics. What is the statistics of dementia in India? The economic impact of having a disease, preparing to live with dementia, understanding dementia, the challenges for caregivers, planning for future, the role of society, caregiving and support, risk factors and prevention, future directions, and a conclusion. So these are basically the contents of this slide. So saying about the background, since we know that dementia is a fast growing disease, we may have different thoughts related to dementia. The first thought may be that it's not me. It has nothing to do with me. It's never going to happen to me. The second thought is that we can have the disease. We can try to prevent the disease. It may not come to me since I will try to prevent dementia. So that's the second thought. And the third thought is the disease may come to me. I am preparing to get dementia. That is, I am preparing to welcome the disease. I am prepared to face the challenges of the disease. And the third thought is chosen by me. So I would like to show the facts and figures why I have chosen the third choice. So prevention is good normally for any disease. We can say that I'm eating right, I'm exercising every day, I'm keeping my mind active. But research shows that there is no way that will protect you 100% from dementia. So that means dementia is inevitable to many of us. That's what has happened to my dad. He got dementia. Anyway, Alzheimer's run in families. So I'm preparing to live with dementia. I'm working to build my physical strength, trying to become a better person. When dementia take away everything that he ever learned in life, his naked heart still shines. I need a heart so pure that if it's stripped bare by dementia, it will still survive. So let us have a small introduction about dementia. Living with dementia can be an overwhelming experience. We may be faced with a gradual loss of memory. We have to depend on many people, and we may lose our self-identity. From a patient's perspective, dementia brings a range of emotions, challenges, and moments of clarity that vary from person to person. Here is an insight into what it might feel like to live with dementia and some facts and figures. Dementia scientifically or medically is a term used to describe a range of brain disorders affecting memory, thinking behavior, and emotion. It's not a single disease, but a collection of symptoms caused by various conditions. We have different classifications of dementia. Somebody may have an Alzheimer's disease. There is something called vascular dementia. There is something called dementia with Lewy bodies. And one more category of commonly popular dementia is frontotemporal dementia. About 60 to 70% of the cases are diagnosed with Alzheimer's disease. The second most common is the vascular dementia. We have 5 to 15% of the cases with Lewy bodies. 2 to 5% of the cases are with frontotemporal dementia. So, some early symptoms of dementia. So, the slide is having some issues. So, memory loss that affects day-to-day abilities, difficulty performing familiar tasks, problems with language. There may be a disorientation in time and space. We may have impaired judgment, problems with misplacing things, changes in mood, personality change. There may be a loss of initiative. The global dementia statistics. There is a worldwide cases of 55 million people living with dementia. It's the statistics on 2023. New cases, nearly 10 million new cases each year. So it is expected to reach 78 million by 2030 and 139 million by 2050. So that's an alarming growth of people having dementia. So if we can take the cases in dementia of India, there is 5.3 million people living with dementia. There is 1 in 16 people aged 60 and above is having the disease. And there is a higher prevalence among women, partly due to their longer life expectancy. Woman is supposed to live longer compared to man. So the cases is expected to be doubled by 2030. That's 6 years from now. So what is the economic impact of dementia? So a global cost is over $1 trillion. That's in 2019, but it expected to be doubled by 2030. In India, since we are a developing country and we have many issues to get solved, there is a significant burden due to healthcare cost, lost productivity and informal care. The people above 60, they are supposed to be non-productive groups. So the issues related to them, it causes a burden to the family. So here comes the main thing that we have to do, that is preparing to live with dementia. That is, we are facing the inevitable thing. That is, first what we have to do is that acknowledge the possibility that dementia might be an inevitable part of aging and can be daunting. But it also provides an opportunity to take control of your future because the disease doesn't come suddenly. It has got several stages and several steps. So by preparing yourself mentally, emotionally, and practically, you can ensure that your journey through dementia is handled with dignity, respect, and as much comfort as possible. So some steps which I have understood, like how to prepare to face it. First is accepting the reality. That is, come to terms with the diagnosis. Acceptance is the first step. Recognize that dementia is a progressive condition. And while it cannot be reversed, you can still influence how you live with it. Focus on what you can control. While you can't control the progression of dementia, you can control how you respond to it. Prepare mentally for the challenges ahead by focusing on your strengths and support available to you. The second thing which you can take care is proactive health management. Prioritize the brain health. Even if dementia is inevitable, taking care of your brain can slow its progression. Engage in regular physical exercise, eat a brain healthy diet, get enough sleep, and stay socially active. Manage chronic conditions. Keep any existing health conditions like hypertension, diabetes, or heart disease well managed, as these can exacerbate cognitive decline. The third thing that you can do is legal and financial preparations. Create or update legal documents. Ensure that your will, living will, and power of attorney are up to date. Consider creating these documents early while you can still make decisions for yourself. Plan for a long-term care. Explore long-term care options, including nursing homes, in-home care, or assisted living facilities. Consider the financial implications and plan accordingly. Organize finances. Make sure your finances are in order. This includes paying off debts, organizing bank accounts, and ensuring that someone you trust has access to your financial information in case you no longer manage it. It is, we need not be a burden to somebody else. So the fourth thing is emotional and psychological preparation. Seek counseling. Engage with a counselor or a therapist to help process your emotions and fears about dementia. Counseling can provide coping strategies and emotional supports. Practice mindfulness. Mindfulness and meditation can help you stay focused on present moment, reduce anxiety, and help you cope with changes as they come. Join support groups. Connect with others who are facing with dementia. Sharing experiences and support can reduce the feelings of isolation and fear. The fifth thing that you can do is social and environmental planning. Discuss your wishes with loved ones. Have open conversations with family and friends about your future. Care preferences, your values, how you want to live as the disease progresses. All this can be discussed in advance. Create a dementia friendly environment. Modify your living space to make it safer and more navigable. Simplify your home. Reduce clutter. Consider installing safety features like grab bars and better lighting. Stay socially connected. Maintain relationships and social activities. Staying engaged with others can help you retain cognitive function longer and improve your quality of life. Maintain your sense of identity. Preserve your memories. Document your life stories, memories, and important events. Create photo albums. Write a journal. Make video recordings to capture your essence. Continue enjoying hobbies. Engage in activities that bring you joy and fulfillment. These can provide comfort and a sense of normalcy as you navigate dementia. Create an ethical will. Share your values, beliefs, and life lessons with loved ones. This can be a meaningful way to leave a legacy that goes beyond the material possession. Seventh one is plan for ongoing care. Identify the caregivers. Decide who you trust to take care of you. Sorry, there was an interruption here. So identify caregivers, decide who trusts to take care of you as your condition progresses. This might be family members, professional caregivers, or both. Respect care for caregivers. Ensure that those who care for you have access to respite care and support. Preventing burnout and ensuring the best care for you. Whether you plan to stay at home or move to a care facility, make decisions about where you will live as your condition advances. Visit facilities or arrange for home care services in advance. That is, you have to consider future living arrangements. The eighth thing is end of life planning. Advance directives clearly document your wishes for end of life care. This includes decisions about life sustaining treatments, palliative care, and your preferences for hospice care. Communicate your wishes. Make sure your family and healthcare providers are aware of your end of life preferences to ensure they are followed. Consider spiritual needs. If spirituality is important to you, consider how your spiritual needs will be met as you approach the end of life. This might include discussions with a spiritual advisor or planning for specific rituals. The ninth thing is stay positive and focus on the quality of life. Celebrate life's moment, focus on what makes you happy, and cherish moments of joy, no matter how small. Surround yourself with people and activities that uplift you. Set small goals. Break down large tasks into manageable steps and set small achievable goals. This can help maintain a sense of purpose and accomplishment. Embrace humor. Don't be afraid to laugh. Find humor in everyday situations. Laughter can be a powerful tool for coping with stress and maintaining a positive outlook. There is the 10th thing, review and adapt plans as needed. Regularly review plans, periodically revisit your legal, financial, and care plans and ensure they remain relevant and reflect your current situation. Be flexible. Life is unpredictable and you may need to adjust your plans as circumstances changes. Stay flexible and open to adapting as needed. The final thoughts which I need to say, preparing for dementia, knowing it may be inevitable, requires courage and proactive planning. By taking these steps, you can ensure that you face dementia on your own terms with dignity, surrounded by people and things that matter most to you. This preparation not only helps ease your journey, but also provides clarity and peace of mind for your loved ones, allowing everyone to focus on quality of life and meaningful connections. Now, as we said about living with dementia, we need to understand dementia. There are some cognitive symptoms: memory loss, language problems, disorientation, executive functioning. There may be behavioral and psychological symptoms: mood swings, changes in personality, agitation and aggression, hallucinations and delusions. We have to adapt to certain strategies. Routine and structure. You have to maintain a consistent daily routine that helps reduce confusion and anxiety. Simple, predictable schedules can be reassuring. You have to do some environmental modifications, create a dementia-friendly environment. So you can use memory aids. Tools like calendars, clocks, reminder notes can help individuals manage daily tasks. Technologies such as voice-activated assistants can also provide the reminders. You can have focus on diet and nutrition, exercise and physical activity. Regular physical activity can improve the mood, it reduces anxiety. You can do simple exercises such as walking or stretches. You can have social engagements, staying socially active. It helps maintain cognitive function. So, communication techniques, use simple, clear sentences, be patient and give the person time to respond. Avoid correcting or arguing about what they say, even if it is incorrect. Emotional and physiological support, counseling and therapy, support groups. Joining the support groups can provide emotional support for both individuals with dementia and their caretakers. We can have a respite care. Caregivers may need breaks to maintain their well-being. Respite care services offer temporary relief by providing professional care for the person with dementia. Some challenges are there for the caregivers also. Physical demands. Caring for someone with dementia can be physically exhausting, especially as the disease progresses. There is emotional strain. Watching a loved one losing cognitive function can be emotionally draining. Caregivers often experience feelings of grief, frustration, and sadness. Thus, there will be financial impact, cost of care, medications, possibly professional care. Giving services can be significant. Strategies for caregivers, they can be educated and trained. They need to understand about dementia. They need to understand about the progression of the disease. Training in specific caregiving technique is also beneficial. You can have support networks. Connecting with other caregivers through support groups or online communities can provide valuable advice and emotional supports. Self-care. Caregivers must prioritize their own health, seeking help when needed, and taking time for self-care activities. Planning for future. Legal and financial planning, long-term care, end-of-life care, the role of society. Awareness and education, that is, we should have public awareness campaigns, policy and advocacy. Government and organizations should work to ensure that adequate resources, support services, and legal protections are in place for people with dementia and their caregivers. Research and innovation. Continued research into the causes, treatment, and management of dementia is crucial. Innovations in technology such as wearable device can assist with the monitoring and improving the quality of life for those with dementia. We as engineers have a role in this. caregiving and support, caregivers, support networks, challenges, all these are facing challenges in a disease with the dementia. The risk factors and prevention. Age is a most significant risk factor. Genetics, family history can play a role. Lifestyle, healthy diet, regular exercise, mental stimulation, social engagement. It can reduce risk. Health conditions, managing diabetes, hypertension, cardiovascular disease. Research, future directions. Ongoing research studies are there to find cure and better treatment. Increasing public awareness and education. There are policies required to support dementia care and research. So conclusion. So dementia is a growing global concern with significant impact of individuals, families, and societies. Early diagnosis, support systems, and awareness can improve the quality of life for those living with dementia. So these are some of the references I have taken for preparing the PPT. So to care for those who once cared for us is one of the highest honors. Thank you. So thank you for hearing me patiently, and I would like to have more discussions on this topic. Thank you.